balding is typically associated with men.
But the truth is 30 million women in the U.S. suffer from some kind of hair loss. Take a look.
Hair loss. It's not surprising when a man loses his hair, but when it happens to a woman, it can be extremely traumatic. Mistakenly thought to be a strictly male disease, women actually make up 40% of American hair loss sufferers.
I'm not only the hair club president, but I'm also a client.
We've seen the commercials and heard all the jokes, but society's obsession with looks has forced these women to suffer in silence as they face issues of poor self-esteem and emotional well-being. According to the Washington Post, American hair loss sufferers spend more than $3.5 billion in an attempt to treat their hair loss. But with a staggering 99% of those products being deemed ineffective, women losing their hair don't know where to turn.
And joining me now is dermatologist Dr. Monica Halem of Columbia Doctors. Eastside, welcome. Good to have you here. Okay, so we talk about hair loss with women. It seems almost that it's more prevalent, but the causes, of course, can be quite different than that with men. Let's go through what are the causes.
So 3 of the most common causes of hair loss in women. One is hormonal imbalance. So as we get older, a lot of times we get more testosterone, and that'll cause what's called female pattern hair loss.
And that's mostly on the top of the head.
It's mostly on the top of the hair and also in the front. You'll have a discrete hair thinning in that area.
Okay, then we talk about trauma or stress to the body.
Trauma or surgery is a big cause of hair loss, and people often don't realize it. The prime example is pregnancy. So after you have a baby, you tend to shed most of your hair.
Isn't it true also, though, if you go on a really dramatic diet of some sort, like a crash diet, you can lose your hair?
Exactly. Crash diets, surgery, any kind of stress or traumatic event that happens in your life can definitely cause hair loss.
And then, of course, there's alopecia areata.
Right. Alopecia areata is a very common cause. It's usually the 3rd most common cause. And what that is it's actually an autoimmune disorder. And what it is your body actually targets the hair follicle and destroys the hair follicle.
You know, hair loss can actually, unlike men, with women, hair loss can happen at virtually any time in your life.
Right, that's true. So men tend to lose their hair a little bit older, although if they do have some of these diseases, they'll go ahead and lose it younger. But women can lose it at any time as well.
Okay, with the alopecia areata, now there's like something like 6 million people in the United States that suffer from that. That's very, very dramatic. That's what we think of when somebody doesn't have any hair at all.
Right.
How do you know if you're starting to lose your hair? We're looking at a picture of it right now, the beginning of it. If you're starting to lose your hair, if you start to fear that, what are the symptoms that it is or isn't that?
So the alopecia areata presents as a discrete area of baldness. It's almost sort of an oval pattern of baldness. And again, it can be widespread, so you can get it any place that you grow hair. Eyebrows, eyelashes, anywhere else.
There's another form of alopecia that, well, there's a myth that you can get it by hair bands too tight, ponytails too tight. Is that true?
Right, it's very true. So there's an entity called traction alopecia, and that's actually from pulling the hair too tight. And we often see this in ballerinas or people that often wear their hair braided constantly, and just that traction alone can destroy the hair follicle.
Well, so if you have to put your hair back for work, for example, or something like that, then what should you do to prevent that?
Well, you want to make sure that you don't put it in a very tight ponytail. So you want to loose your ponytail, and when you get home, make sure you take it out and you're not wearing it constantly.
Sometimes the loss of hair can be because of medications or high levels of vitamin A. Tell me about that.
So certain medications, and it's very common, it's more common than people realize, can actually destroy the hair follicle and also change the hair growth phase. So instead of being in a growing phase, they go to a falling out phase, and you can lose hair.
What kind of medications?
Anything from blood pressure pills, cholesterol pills, vitamin A. There's plenty that can do that.
Wow, so I guess you maybe need to check and see what other medications you should take in place of them if it does have extreme hair loss. Okay, what can you do? What can your doctor do to help you with hair loss?
So there's many things that you can do. First of all, you want to see a specialist because you want to make sure that you get the diagnosis as to what's going on. And only a specialist can do that. You can take vitamins. I usually recommend to my patients to take biotin at 25 micrograms, and you can get that right over the counter. That's great for skin, hair, and nails. You can, look at your hormones and have a hormone imbalance replaced, as well as some injections. We can also inject certain types of medication.
Right, so you're talking about, there's topical medications like Rogaine that you can use. There's oral medications like what you were talking about with the biotin. make sure you correct your hormone imbalances, that you treat scalp infections, and the best way to treat those again is
To see a specialist and make sure to see what the infection is.
those shampoos, that sort of thing. Does that help?
It doesn't help right away. You really need to diagnose what's going on.
All right. Thank you so much. It's something we all think about at times, especially when the brush is full of hair. Thank you, Monica. We
welcome.
really appreciate it. Sarah?
Thanks, Jane. After the break, Maria